So we've got a case here, 33-year-old female, 7-month history of knee pain, beach volleyball player, jumped, landed in the sand, twisted, heard something pop, immediate pain, swelling, x-ray at the hospital was negative, had some physiotherapeutics done, 4 weeks worth.
Yeah,
roughly. Yeah, there you go. So some, pretty standard stuff, treating her for potential intra-articular damage, not really sure what at that point. So some pretty generic quad exercises and loading and isometrics and stuff. Not returning back to function, happy. This knee is now swelling. The lady has a job where she has to stand long periods of time, and it swells up like a nice big balloon. So obviously something is not well. Tissues are healed. So there's two things you're concerned with always when you're restoring normal function to a joint. One is the actual mechanical forces that cross that joint. You want to balance them. And secondly, you want to make sure that the tissue is healing properly, whatever that is. So one of the cool things that I wanted to show you guys is we have diagnostic ultrasound here, our handy GE LOGIQ E. So this guy is proving to be a real cool part of our diagnostics here. So what we're going to do is, inflammation outside of the joint, inflammation outside of the joint is inflammation, or swelling. Inflammation inside a joint is called effusion. It's still the same stuff, it's just that's how we label it. So, but the thing is if you have inflammation inside a joint, you're concerned about that you've torn or damaged something, obviously one of the structures inside the joint. In this case, I think it's meniscus. Her PCL and ACL tests were negative. Arcupopliteal, oblique popliteal in the posterior aspect of the knee, good, everything's checking out fine. What isn't checking out fine is that she's got joint line tenderness along the medial aspect of the knee, and when I do what's called a bounce home test, so a forced extension test, she doesn't like it, and she also doesn't like forced flexion and compressive flexion. So one of the cool things I just wanted to show you guys real quick was what this machine can show us and confirm. So I'll just get you to squeeze your quads for me there. Good. So we're just going to do what's called a swipe test here. So just hold your quads tight there for me. Just going to bring this to this side here. There's the bottom of the joint line. There's the joint line. You can just start to faintly see it. The tibia here and the end of the femoral condyle, and her meniscus is in that potential space right all in there. So we can take this out and look back at the MCL ligament, which she's having no problem with there. You can see the attachment up along the tubercle of the femur here. That's vastus medialis that I'm poking my finger into right there. You can see the muscle moving a little bit. I do this right here. There's medialis. I'm poking my finger into that. So we come back down, and what I wanted to really show you, what was really cool, there's the joint space again, and if we come back alongside there, let's just start to see the meniscus in there. Really hard to diagnose a meniscal tear with an ultrasound, at least at my level. And then this is what's causing her a bunch of problems here right now. So we're just gonna swipe test that, and you can see all of that fluid. See that pocket of black up there? That's the fluid, that's the effusion that we're picking up right there. You can see that fluid, and I'll just compress it now, and it goes away, and I move open, and there's the fluid. So let's just swipe the fluid back. Let's move up here a little bit. So there's, I'm gonna swipe that fluid out of there again. Let's get that fluid out of there. So you're pretty surprised when I showed you that fluid, eh? Yeah. So yeah, so it's kind of just a neat party trick, but it's very cool. Okay, relax your quad now. So we're just going to swipe test that again, and you'll see the fluid come in from the outside. Look at all that fluid there, all that dark matter that you see there, all the fluid there right alongside that. So VMO is just above that here, and what happens is when that fluid, you need about 4 milliliters of fluid to start shutting down. I'm going to poke my finger into VMO right there. Okay, that starts shutting down. VMO attaches down here, or blends into the patella, pardon me. So that's a big issue to me. Like, you can see that. Look at that fluid there. I'll just swipe test that all through there, right? That's not good. and that is the result of the joint effusion from what I believe is a torn meniscus. So what we want to do now at 7 months, I'm not going to do a heck of a lot of physio with her again. We're going to obviously give her some quad control, get her hip control. At this point now, her psoas unfortunately is a little bit weak, so we're going to balance the lower kinetic chain. But we want to MRI this, and then we're going to PRP it. We're going to PRP the meniscus, because this is, in my opinion, this is a non-operative intra-articular damage. We're going to verify that with the MRI. That's why we want it now, right? Early days we wouldn't have. We would have just probably shot right there if we couldn't get you better right off the bat. So listen, your tissue is either healing or it isn't. You have to face those facts. And over here at Performax, if the tissue isn't healing, we start bringing in proliferative therapy, because it works extremely well at bolstering collagen. And that's it, man. That's just how we do it. So until our next edition, this is live in the lab at Performax.